Have you ever heard that early diagnosis makes the difference between life and death? Well, know that this is not just a slogan, but a scientific truth. There are signs your body may be sending you long before a tumor develops into something serious. Yet many people ignore them, mistaking them for temporary annoyances or symptoms of tiredness. But here's the kicker. Knowing these signs could give you over a 99% chance of recovery in some cases. Impressive, right? And we're not just talking about easily curable tumors, but also of aggressive forms such as pancreatic cancer. If detected early, even the most fearsome of tumors can be successfully treated. In today's video, we'll explore 10 early signs of cancer that you may never have taken seriously. Some of them will surprise you, others might even scare you. But ignoring them would be an unforgivable mistake. Watch until the end, because one of these signs could be more relevant to you than you think. If you find this video useful, please like and subscribe to the channel to always receive crucial information about your health. Write in the comments which of these signs surprised you the most and help us spread awareness. Now let's start with the first sign that you should never ignore. Sign 1. Extreme and inexplicable tiredness. Do you wake up in the morning feeling like you haven't slept at all? Do the stairs you once climbed with ease now seem like a mountain? This persistent tiredness is not normal and could be a warning sign. Cancer can cause anemia, reducing oxygenation of your organs, and leading to a constant sense of exhaustion. This is because some tumors can consume a large amount of energy or produce substances that alter metabolism. Additionally, some types of cancer affect the production of hormones that regulate the sleep cycle and the energy level in the body. If you notice that your energy has dropped dramatically for no apparent reason, get your blood and thyroid checked. It might not be anything serious, but it could also be the first warning bell. Also, if tiredness is accompanied by dizziness, pallor, and difficulty concentrating, this could be an even more significant signal. Some people tend to minimize these symptoms by attributing them to stress or to a hectic life. But if they persist, it is essential to investigate. Sign 2. Abnormal bleeding. Any unexplained bleeding deserves immediate attention. Whether it is blood in the stool, in the urine, in catarrh, or frequent nosebleeds, it's a signal that your body is trying to tell you something. Some cancers, such as those of the colon or lung, can cause internal bleeding. For example, a bowel tumor might cause small amounts of blood to leak out, making your stool darker or tarry. If you notice blood in your urine, it could be a sign of kidney or bladder cancer. Don't wait for the problem to get worse. Consult a doctor immediately. Also, in women, abnormal bleeding between periods or after menopause, they can be signs of gynecological tumors, such as endometrial or cervical cancer. If these episodes occur with a certain frequency, it is essential to have a checkup. Sign 3. Sudden blood clots. Cancer can alter blood clotting, increasing the risk of deep vein thrombosis. If you have had clots without an apparent cause, such as trauma or a recent surgery, it is worth investigating. Many tumors release substances that make the blood more prone to clotting. This can lead to the formation of blood clots, which, if left untreated, can migrate to the lungs and cause a dangerous pulmonary embolism. In some cancer patients, thrombosis can even be the leading cause of death. If you experience swelling, pain, or redness in a leg, see your doctor immediately. Also, symptoms such as chest pain and sudden difficulty breathing. They could be signs of a pulmonary embolism, a serious complication of blood clots that should never be underestimated. Sign 4. Skin changes. Dark spots, moles that change shape or color, wounds that don't heal. These are all signs of possible melanoma, one of the most aggressive skin cancers. Do not underestimate any skin changes. If you notice a mole that is growing rapidly, that changes color, or that starts to itch and bleed, book a dermatologist visit immediately. Early diagnosis of melanoma dramatically increases the chances of recovery. Another sign that should not be overlooked is the appearance of thicker or scaly skin in some areas of the body, which may be indicative of non-melanoma skin cancers. Prevention is essential in these cases. Check your skin regularly and protect yourself from the sun with adequate sunscreens. Sign 5. Sudden and unexplained weight loss. If you have lost more than 10% of your body weight in the last 6 months without changing your diet or level of physical activity, this could be a warning sign. Some cancers, such as pancreatic cancer, to the lungs or to the intestine, can alter the body's metabolism and cause significant weight loss for no apparent reason. This weight loss may be accompanied by a reduction in appetite, early satiety, or digestive disorders. If you notice sudden and continuous weight loss, consult a doctor to rule out serious causes. Sign 6. Swollen lymph nodes or lumps under the skin. Lymph nodes are part of the immune system and help the body fight infections. However, persistent, unexplained enlargement of the lymph nodes, especially in areas such as the neck, the armpits, or groin, could be a sign of lymphoma or other forms of cancer. If the lymph nodes remain swollen for more than 2 weeks without obvious infection, or if they increase in size over time, it is important to undergo medical checkups. Some skin or soft tissue cancers may also present as palpable lumps under the skin. Sign 7. Persistent pain without any apparent cause. Pain that persists for weeks or months and cannot be explained by injury or other conditions may be a sign of cancer. Bone tumors, brain tumors, or metastases can cause persistent pain. If you have chronic pain that does not respond to common pain relievers and continues to get worse, it is essential to talk to a doctor. Not all pain is caused by cancer, but if it persists without reason, it is best to investigate. Sign 8. Difficulty swallowing or changes in bowel habits. If you have difficulty swallowing solid foods or liquids, or you feel like something is stuck in your throat, you may have a problem with your esophagus or throat. Esophageal cancer can cause progressive dysphagia or difficulty swallowing food that gets worse over time. Likewise, if you notice persistent changes in your bowel habits, as chronic constipation, persistent diarrhea, thin stools, or rectal bleeding, you may have colon cancer. Any changes in digestive function that last more than a few weeks should be evaluated by a doctor. Sign 9. Persistent fever or night sweats. A persistent fever without any apparent cause, especially if accompanied by intense night sweats. It could be a sign of leukemia or lymphoma. Blood cancer can disrupt the immune system and cause recurrent fevers without an obvious infection, as chronic constipation. Consult a doctor for a thorough checkup. Sign 10. Chronic cough or changes in voice. If you have a persistent cough that lasts more than 3 weeks without a cold or other respiratory illness, you may need to have tests to rule out lung problems. Lung cancer may initially manifest itself with a dry, persistent cough, which over time can become productive or associated with blood. Similarly, a change in the voice, such as persistent hoarseness, may be a sign of laryngeal or thyroid cancer. If these symptoms last a long time, it is important to undergo a specialist examination. Andrew's case. Andrew, a 49-year-old man, led an active and carefree life. Then, he started feeling tired all the time. He thought it was stress, but the tiredness was getting worse. One day, he noticed a swelling in his neck that wouldn't go away. After months of procrastination, he decided to get checked out. The diagnosis? Lymphoma. Fortunately, thanks to early diagnosis, Andrew started treatment in time and is doing well today. His biggest mistake? Ignoring the signs for too long. Don't do the same. These signs can make the difference between an early diagnosis and advanced disease. If you notice any of these, don't wait. Get a medical checkup. Help us spread this word by liking and sharing the video. Subscribe to the channel for more content that could literally save your life. Which of these signs surprised you the most? Write it in the comments. Remember, your health is your priority.